Hi, this is Dr. Patrick Abbey with the Maxillofacial Surgery Center here in Tampa, Florida, giving a brief video overview of the types of maxillofacial trauma that we treat at our office. This entails fractures from a myriad of different reasons, be it from personal violence, from motor vehicle accidents, from other types of accidents and falls or trauma itself. Obviously, there are numerous bones in the face that can be broken, and our specialty is in treatment of those bony fractures. Sometimes this will involve the lower jaw or the mandible, sometimes it will involve the upper jaw or the maxilla, and oftentimes higher bones within what we call the midface, which include the cheekbones and bones of the eye socket. This all falls under our purview of expertise and training in terms of reducing these back to a cosmetic and functional position. This is primarily the biggest reason for our interaction in this field of treatment, as both of those entities, in terms of restoring a patient's aesthetic appearance back to normal and co-joining that with restoring their jaw function, their occlusion, and their bite relationship back to the pre-trauma positions, are both just as vital and important. You cannot accomplish one without the other and have a patient feel as if they are back to their normal self again following such an incident. Our expertise lies in that in treatment with various modalities, which can include a simple closed reduction, where there are often patients where the safest, most effective treatment will still simply entail wiring their jaws shut or wiring their teeth together. This provides stabilization for a fracture that is not severely displaced to be able to heal without the necessary intervention and increased risk that can go along with plate or fixation placement, such as an infection. Oftentimes the displacement is severe enough, and there are indications where the rigid internal fixation or the use of titanium plates and screws is indicated and necessary. These can provide stabilization of the bones where wiring of the teeth shut is not necessary if the fractures involve the jaw structure, and for some of the more aesthetic areas and of regions where critical placement of the bone back into its proper position is paramount, those plates and screws provide that ability of fine-tuning of that placement to be able to hold in the right position. Typically, these surgeries are done through the hospital setting. Oftentimes, patients are already admitted as an inpatient from the trauma that they suffered from to begin with. Sometimes we are having patients wait several days before their surgery to allow the swelling to reduce to optimize their aesthetic results at the time the procedures are done. I have privileges at University Community Hospital where all of our inpatient services are provided, but see patients through the office setting in terms of their diagnosis and treatment planning, which usually can be accomplished in a single visit following the patient's traumatic incident. So we'd be more than happy to see patients for consult in that regard and provide them with that care as needed. And any further questions can be presented at our office upon your visit. Thank you.